Okay, lecture 5, we'll be talking about contamination control and personal requirements for parental drug manufacturing. I think these topics you are very familiar with because you probably learned these in your previous classes. Hopefully it'll be a short review for you. If you're bored, just be patient. There will be some new topics coming on later. Okay, so contamination control, of course. Reason why the therapeutic protein product, injectable drugs, they contain the natural nutrients sources for the microorganisms to grow in, because the injectable drugs made out of proteins should be kept at neutral pH, isotonic condition, the buffers and the 20 millimolar salt. That's naturally perfect conditions for microbials to grow. So things can grow in there. If things are growing, if they're injected, of course they're not good, right? So you should not have any contamination of your product with microbials. So there have been a lot of product recalls and complaints, and even the incidents where patients died because of product control. You may heard about people dying because the compounding contamination happened in some place in Boston area. When they compound injectable drugs, the compounding process was contaminated. So yeah, things like that happen. So source of microbial contaminations, then where do they come from? Okay, of course, the atmosphere, the air. There are a lot of spores that are floating, so they could land in your drug product and they can grow. And then raw materials, of course, including water. Water may have the microbes in there. Pseudomonas species, Bacillus species, E. coli, those are kind of indigenous, meaning naturally happening microbials in the water if they are not treated well. Of course, the raw materials, like I said, whatever your drug products is using, so growth media, of course, the cells themselves making the API, and they could have maybe the packaging material, primary, secondary, all those could have those, like E. coli, Salmonella, and like I said, packaging material as well, secondary packaging, primary packaging materials. Cardboard container, rubber closure system, papers with moisture support. They can grow mold, spore, penicillium, aspergillus, and bacterial cells. And other sources, building itself, walls, ceilings, plasters, that can have some molds, floors, cracks, gaps. They can have a lot of cells. Equipment as well, if they're not cleaned well, they could have contaminants, and maybe screws, threads, agitator blades, or valves. They may have little havoc of bacterial cells. Of course, the largest contamination source is the people. People who walk there. Skin, hair, moisture from breathing, coughing, sneezing, cosmetics. Anything from the clothing material. They may have lots of bacterial cells. So if you're walking, you are shedding a lot of particles, maybe 10,000 particles per minute. A lot of you is not just you alone. As you know, a lot of these cells, streptococcus in your sweat or hair, micrococcus, and your sweat, another species of streptococcus, and skin flake may have micrococcus. So many possible contaminants coming from you. You're breathing and sneezing, you can shed a lot, basically. Yes, it's gross, but yeah, people are filthy. And then, yes, your movement can generate a lot more particles as well. 100,000, million, 5 million, depends on the activity you're involved in. So, clean room is a place where manufacturing should take place, because you're controlling air quality and everything. So clean room should be well maintained, should be cleaned on a regular basis, and cleaning tools should be lint-free, should not generate a lot of dust, of course, by themselves. and the sanitization, disinfection agents you will use. So cleaning crews will come in, they will do the routine daily cleaning. They'll be using these chemicals. But understand the meaning of these terms: sanitization, disinfection. Okay, they are different from the term sterilization. Right? You understand the difference, right? Sanitization, disinfection. Those are the ways of reducing the bioburden, right? Reducing. But sterilization is a way of eliminating, removing completely. So that's a big difference. And those chemicals are made out of these kind of things: quaternary ammonium compound, phenolic mixture, alcohol, biguanidide, and formaldehyde, sometimes chloride, peroxide, glutaraldehyde, and things like that. Something that's toxic enough to kill bacterial cells. And maybe LPH, Stericops LPH is a well-known sanitizer, used a lot in many places. And one thing you need to remember is sanitizers are not all sporicides. Sporicides are stronger chemicals that can kill the spore form. Spore forms of bacterial cells are much more resistant because it's hard to break kind of a structure. So you need to have stronger chemical to get rid of spores. So understand the definition of this terminology because they're used a lot. Sometimes they're used wrong way because people do not understand exact meaning of these terms. Okay, so antiseptics are agents used against sepsis, to prevent sepsis. So they are chemicals that can eliminate bacterial cells and endosperms, endotoxins, and things like that. And disinfectants, same way, kind of similar, an agent that is applied to inanimate object, meaning making them less active, inactivate. It does not necessarily kill all the organism. Okay, so it's not 100% kill. That's what it means. Sanitizer, again, similar agent that reduces, it's not eliminating, reducing the microbial organisms contaminations. So disinfectants, sanitizers, antiseptic, they're kind of similar. Okay, germicide, similar, the agent that destroy microorganisms, but not 100%. Bactericide, same way, killing the bacterial cells, what they are. Bacteriostat, an agent that prevents the growth of specific group of microorganisms but does not necessarily kill them. So it's preventing the growth is what these chemicals do. Sanitization is a process of reducing microorganisms by applying sanitizers, right? Sterilization is the one single word that has different meaning compared to other words listed here. Sanitization is a process destroying all organisms, meaning eliminating, removing all organisms. So that's the unique word here. Okay. And then practical disinfectants, different kinds. So you could use liquid-based disinfectants like quaternary ammonium, okay, or chlorine, ethanol, formaldehyde, glutaraldehyde, isopropyl, phenolic compounds. So you can use these. Those are liquid-based. There are gas-based sanitizers like ethylene oxide and paraformaldehydes. Okay, they are effective to killing maybe viruses sometimes and broad-spectrum bacterial cells. Yes, okay, mostly best to bacterial cells. But you have to look at here, bacterial spores. Okay. Are they killed by all of these? The answer is no. Quaternary compounds, no effect. And ethanol, no effect. And isopropanol, no effect. Phenolics, no effect. So these guys are not sporicides. Only these guys, like idofo and glutaraldehyde, and these are kind of questionable. Those guys can kill spores. Okay, not all of them. Okay, and M. tuberculosis, these are mycoplasma. Okay, again, different kinds of contaminant source, mostly killed by most of them. Okay, understand this. And gas-based sanitizers are effective in most of them. Okay. And then cleaner maintenance, of course, they should be cleaned regular basis. Okay, and then cleaned and sanitized. That's the rule. Okay. When you sanitize the cleanroom area, you have to use effective sanitizing agents. Those sanitizing agents are effective, so their efficacy should be demonstrated through the study. So you have to be able to see 2 to 3 log reduction. So what's the 2 to 3 log reduction? Log reduction means 1 log is 1/10th, so 10% kill. 2 log reduction is what? 1/100th, so 100% kill almost. And 3 log reduction would be maybe 1/1000. Okay, so that's significant reduction. So it basically 99% kill is 2 log reduction, 99.9% kill is 3 log reduction. Yes, you have to demonstrate, if your sanitizers or cleaning and sanitizing method is really effective, okay, to give you 2 to 3 log reduction. Okay, so the study should be done and demonstrate, documented. And then sanitizing process. It can be classified as 3 different ways. One is deep cleaning, that's done maybe once every shutdown of the room. Okay? That's deep cleaning. And then routine cleaning will be it's done by daily basis, daily basis by cleaning crew, a support group. Okay, so they would come in and clean. Okay, so it's a maintained, scheduled cleaning process. That's a routine cleaning. And then continuous cleaning will be, every user who's working in the clean room space, they should clean. Okay, maybe spraying in and sanitizing in, and their glove hands should be sprayed as well. Utensils and whatever instruments they use, they have to clean up whenever they do. So it's a continuous cleaning. So by implementing 3 different cleaning methods, sanitization method, your clean room space will be clean, your operation should be clean as well. Okay, and disinfectants should be rotated with sufficient frequency. Okay, you don't want to use one chemical for a long period of time, because there's a tendency that those microbials, contaminants can build the resistance. So to avoid development of the resistant strain, okay, so you're asked to rotate out, switch out your chemicals, disinfectants. And when these cleaning crew come in and clean routinely, they use this 3 bucket system. Okay, cleaning. Okay, so in these 3 buckets, you will have sanitizing solution, UFI water, squeeze drain. Okay, so maybe a couple of them will be sanitizing solution, UFI water, and that should be maybe squeeze drain and sanitizing UFI water. Okay, so you will probably use sanitizing solution to mop first with using figure 8, and then squeeze it, okay, and then use UFI water to clean it after that. So that should be the case. Okay. So containers and equipments making contact with the parental drug prep must be cleaned with extreme care, of course. Equipment should be reserved and used for one product only. And you should not have any mix-ups between different products, different manufacturing campaigns. Okay, and various types of container washers are used for various types of sterile product containers. For basic principle of cleaning should be liquid or air should be introduced in such manner that it will strike the bottom of the inside of the inert container, spread in all directions and flow down the wall down. Okay, so that's the cleaning method. And clean should alternate hot and cold treatment with the final rinse with the UFI. So we're talking about CIP, SIP method. Metal components of the washing cleaning equipment should be all constructed with the stainless steel, because it doesn't change, it doesn't lose its component, or other non-corroding, non-contaminating material. High-grade stainless steel, that's what it means. Detergents are not used for containers due to the risk of leaving residues. 1 or 2 hours of treatment of 250 degrees Celsius, that is good for pyrogenation, and the toxin should be removed. And rubber closure systems cleaned with gentle agitation in a hot solution of mild water softener or detergent, followed by several rinses with the UFI water. And cleaning equipment should be cleaned in place. Makes sense, right?